My name is Maga Guglia. I represent a community advisory panel, and I also represent a European AIDS treatment group. When we talk about youth engagement in clinical trials, there are two main problems. The first one is lack of awareness. People mostly don't understand why their participation matters. And the second is lack of accessibility. Since the clinical trials are mostly considered for adults, not for young population and especially for children. One of the challenges ensuring young population is included in design phase of clinical trial. It needs more time, more efforts to include them in trials, and on the other side, industries also tend to avoid their inclusion because it needs more negotiation, more legal aspects to review, and also it needs more changes to be done. Even it's seen to be too complicated, it's better to try and include these people in the trial, young population, in spite of these obstacles. Another challenge is related to communication. The language, difficult language, sometimes is used during clinical trials, the medical terms that are not understandable for young population. It's better to ensure the modification and simplifying the language and make all the communication between researcher and participant easy understandable. This is important, it matters. Within RBD-CO project, we faced all these challenges, but we could deal and manage some of these problems. We made the communication channels more accessible, understandable for the clinical trial participants. We did not only translate the medical terms, but we rephrased them to be more understandable for clinical trial participants. We also ensured that the sponsor of the study could understand why their participation matters. Participation of community, including young population with chronic conditions, that their participation is essential. Unfortunately, despite all the efforts we made as a community advisory panel, we did not see the number of pediatric participants we had hoped for. In this project, we learned valuable lessons by creating accessible and inclusive materials that we can use for further clinical trials and replicate them. I think having community advisory panel that consists of community representatives, people with lived experience or knowledge of the process, that made a difference at the end. Now we know that inclusion matters and it should be started from the very beginning. And now we know that we need more time to devote for protocol review, and more effective communication channels should be developed between researchers and participants. And the participants should be treated as equals through the process. Now I believe that community advisory panels or youth advisory panels are very useful to be included in clinical trials from day one. I truly hope that youth will not be just included, but heard as well.